Hi, my name is James Whitfield. I am with the nonprofit Washington Health Foundation, your independent partner for health and healthcare for more than 20 years. And this is a picture of my mom. It's a little blurry, but I think you can tell that she's pretty proud. It is because that's the day that I was sworn in as the regional director of the U.S. Department of Health and Human Services. A little bit after this picture was taken, she had a massive heart attack. Now, she is fine. Everything's okay, primarily because of some great work from one of the local hospitals. But the work that we had to do collectively in order to get her out of the hospital and help her get healthier, frankly, led to the thing that I want to talk to you about today, which is personal health advocates. The research is actually very clear. If you have somebody that knows health and healthcare, who is an advocate for you on your side through the health, any interactions that you have with health and healthcare, the research says that your health outcomes can be considerably better. And that's what personal health advocates do. So let's talk about what a personal health advocate is with the Washington Health Foundation. First, they are a broker, someone in order to help connect you with the health insurance that you need. We have licensed health agents on our staff in order to help make sure that that happens. Second, we act as a coach. I don't know if anyone here has ever been a little bit confused about the way that their health insurance works, but we certainly have clients who are. Like the lady who had a question about the mole that she had on her face. She wanted to know if her health insurance was going to pay for it. We helped her understand that her health insurance company would pay to remove that mole if it itched. They would not pay for it if it didn't itch. Lucky for us, she had an itchy mole. The third thing that we do is we play the role of quarterback. Sometimes we have to climb out of the coach's booth and actually get down on the playing field. The way that we do with some of our clients, which one of us called us, she could not find the right person in order to help her son. So we actually kept her on the telephone line, looked at her insurance, identified the right provider for her, got that person on the phone and actually connected them in real time and made sure that she was going to get the services that she needed before we hung up. We also play the role of private detective. Raise your hand if you've ever received something from an insurance company or a hospital and you weren't quite sure what they were telling you. Should I pay it? Should I not pay it? Maybe I'm being denied, right? Our clients simply take a photograph of those things with their cell phones and email them to us. We do all of the investigative work in order to help them understand whether they should pay, what they should pay. Last but not least, though, sometimes you need to have someone who simply has a bad attitude. Because every now and then, the insurance company just doesn't want to pay, which is what happened with one of our clients who was being denied a bill of $30,000. And through a series of strongly worded letters to the right people at the insurance company, that actually was turned around and that she did not have to pay. So how much does this cost for you? Turns out that it doesn't cost anything. It doesn't even cost actually getting a kid of yours to marry somebody who understands health insurance. You don't have to pay for a wedding or anything. And that is because of a transaction that most people don't fully understand. It turns out that when you pay an individual or small business health insurance premium, about 85% of that has to go and pay for medical claims. But 15% of it can be used for things like administrative costs and profits, if it's a for-profit insurance company, and a small portion of that actually is set aside for insurance broker commissions. Whether you use a broker or not, it doesn't matter, those commissions are still set aside. And in fact, by law, the insurance company cannot give you the difference as a discount, right? That money is set aside, and as you see here, over $50 million a year in Washington State is actually set aside for health insurance premiums, for health insurance commissions, and our personal health advocate service actually can utilize those commissions in order to fund our activities. So what's the effect of the new healthcare laws? It turns out that the new laws that are going into effect are driving far more people to need to utilize our service to understand exactly what the new laws are. And so we are then able to drive our innovation, which is, in fact, sustainability. We currently have over 500 clients. That translates to roughly $10,000 a month of recurring revenue. And while anybody who calls us, we will absolutely serve, the fact that we do have those people who are our clients actually drives our sustainability model. And our goal is to continue to have more people become clients of ours that we can serve. Our ask is pretty simple. We've invested roughly $60,000 in marketing over the course of the past month or so in order to make sure that we can assist more people who are trying to figure out the Affordable Care Act. We're asking for another $30,000 in order to help do that into the next year. We have talented folks on our staff, as I mentioned, very talented people who understand health, healthcare, and health insurance. And our board is made up of people from physicians and hospitals and other parts of the health and healthcare system that helps us understand how to do this work. So in closing, I can say that not everybody can have a miracle mother like mine, and it turns out that most people actually don't have a son or daughter who does understand health and healthcare. But you can adopt one for free, and that's called a personal health advocate by calling 855-Y-HEALTH. Thank you.